welcome back to 12 News. We have Dr. Quinn here to talk about something very important everyone's been wanting to know the answer to. So the medical world can be a headache to navigate, even before insurance companies get involved. So today we're going to talk with Dr. Quinn and get some answers on how to process to get the prescriptions approved by the insurance companies. So Dr. Quinn, how would you explain, and this is a big word concept, prior authorizations for those prescriptions, and how do you deal with that every day?
Well, today I want to focus on the prior authorizations for the medicine that help you reach a healthier weight. Everybody might want to take out a pen and paper and take notes. Your medical provider's team, including the medical provider, they have to be willing to work the work. It's called the prior authorization. And I will admit, when I first started 2 years ago, when I got my board certification in weight management, I didn't even know how it worked. But there's a blueprint. If you are someone that's interested in getting on the weight management medications that are effectively proven to work, and I see it every day, there's a protocol.
Well, right, and what is that protocol, Dr. Quinn? How does the FDA play a role into that? And just tell me a little bit about your experience, too, on the doctor's role and seeing that through.
Right. Now, the FDA is the Food Drug Administration. These pharmaceutical companies are now seeing that the latest medications, to include the Wegovy, which is the same active ingredient as Ozempic, and the Zepbound, which is the same active ingredient as Mounjaro, they are medically proven, followed up with the FDA certified to help you with more than just getting to a healthier weight. Let's remember that these medications were initially developed specifically for people with diabetes. So if you have diabetes, then your medical doctor can prescribe you these medications, but they have to be willing to do the prior authorization if the medicine is denied. If you have a diagnosis of diabetes with a hemoglobin A1C of 6.5 or greater, then all they have to do is put that on the prior authorization paperwork online, or either on paper, depending on the insurance company. But for the Wegovy, which is the Ozempic, same active ingredient, if you've had a heart attack or a stroke or something called peripheral vascular disease, which is problems with the blood vessels in your legs, they have to document that as well, and the medicine is approved. Also, if you're trying to get the Zepbound, if you have a history of sleep apnea, it can get approved if your doctor's office is willing to do the work.
All right. I mean, you said that a couple of times, so that's a good information. Many people don't know if your doctor is willing to do that work and if they have the education that they need, right? So that plays a big part. But what can patients do? Maybe they're having trouble getting this to move along with that authorization process. How can patients help move that process along a little bit faster and easier?
Well, what that patient can do is they can call their insurance company and find out what's the prior authorization process for that insurance company, specifically for that patient, for that medication, and then they can call the doctor's office. I say call every day. So just stay on them, because your doctor's responsibility is to do everything that he or she can to make sure that you get the medicine that can help you live a safer, more healthy life that you deserve.
Yes, and a life to the fullest, right? I mean, because once we're healthy weight, and many people struggle with that, and thankfully we have those the doctors like you who want to help us get there, and so that's always a crucial part of the whole thing. Is there anything else that maybe patients need to know specifically when it comes to prior authorization or just these weight loss drugs in general?
Basically, they just need to become an advocate for the doctor. Call the insurance company and find out, is it a possibility? And if it is a possibility, stay on that doctor. And if the doctor is not willing to do anything, feel free to look for a different doctor. Because at the end of the day, everybody deserves it.